Thank you for listening to Pierce Clinic Stories, the show where we hear testimonial stories about the patients of the Pierce Clinic of Chiropractic in St. Petersburg, Florida. I'm here today with Dr. Jeff Fowler, and he is going to tell us about a patient who suffered with a neurological condition called trigeminal neuralgia. Hello, Dr. Jeff.
Hello, Dr. Hambrick.
How are you?
I'm doing excellent, thank you.
Well, tell us about this condition, also called tic douloureux.
That's exactly right. Yes, this is a neuropathic disorder, as you had so cleverly described before, characterized by episodes of intense pain in the face. It originates in one of the three branches of the trigeminal nerve, which is cranial nerve number 5, which again originates at the brainstem level, and it comes across areas that may affect things such as the eye, the ear, even across the lips, into the nose, across the scalp, even to forehead, cheeks, teeth, or jaw. Alongside of the face. And interestingly enough, I saw some research that showed that some patients actually experience pain in their left index finger. The information that I've collected also talks about there being no cure. Estimated that 1 in 15,000 people suffer from this debilitating disease, also known as the suicide disease. Significantly higher to frequent misdiagnosis. So they're saying that these people are being affected but not knowing exactly what's causing the problem, and even worse, what to do to fix it. It brings about severe stabbing pain, electrical shock sensations, even other times a pressure or a crushing sensation. Burning sensation may also be reported. Even from things as gentle as a touch to the affected area of the face, sometimes spontaneously without any apparent stimulation. Sometimes it's from chewing, or sometimes talking, or some folks have had it elicited from brushing their teeth, and it's really a very painful situation. And the gentleman we're going to be talking about this evening was dealing with this type of severe stabbing, burning sensation across his face. As you see the microphone right across here, it went right across his jaw area and somewhat up into across his lip by his nose. And Dr. Hambrick, he'd been dealing with this for over 12 years without any relief factor that he had found. He'd been to see a couple of medical doctors, one of them being his main neurologist, as well as his main general practitioner. And some of the remedies that they had given to him were different types of medications, some geared more towards seizure disorders, some towards migraine headache remedies, nothing that was really geared, in essence, towards helping him with relief of this severe nerve pain, nor did it offer any relief even as he had tried them. And he had given his life in service to youth as a teacher. He was involved with emotionally and behaviorally disturbed students in the junior high level as a science teacher, and had really done many exciting things with them to motivate them in their learning and understanding these concepts before them. And it was just really, really challenging to hear how he had gotten to the point where he was virtually self-medicating with alcohol. Trying to, again, relieve this element of pain that he was feeling that would literally sometimes bring him to his knees. Oftentimes when he was lecturing to his students, they would know exactly what was happening to him because he would have to pause in his lecture, and sometimes he would hold his face. Sometimes a pressure to the area in certain ways might offer some relief for him. Well, I had been invited to go over to their school over in the Tampa area to do a orientation class for the staff. And in doing so, had sparked some interest in him, thinking about how his nervous system may be playing a role in this severe and debilitating disease that he had been experiencing. Upon the conclusion of the lecture, he'd asked me some specific questions about whether we had worked with cases like this before, and you know, what were our outcomes, you know, were they good, was there hope? And I was happy to share with him that we have worked with similar cases to his before with great success, and it would certainly be worth an evaluation to see if he was a candidate for the work that we do over here in St. Petersburg. Well, he did come into the office, and upon a very thorough health questionnaire, we were able to uncover all of the different details associated with his symptoms that he'd been having for these past 12 years, and exactly how it had affected his life. He was a very skilled musician, playing the guitar and other types of musical instruments, and was having to cease playing those because this pain was to the point where all he would need to do when he got home was to rest in order to give himself relief of what he'd been dealing with all day long. There were times where he would have to call in a substitute teacher to cover for him because of this facial pain, and again, affecting other things in his body because of the medication that he was taking without success, just causing more symptoms on top of it. It was just really a downward spiral that wasn't good for him nor his wife by any means at all. So the evaluation that we had done, which started out very simple with some postural details, led us into some more detailed neurological and orthopedic testing, which revealed a swollen nerve in his neck, right around the brainstem area where the trigeminal neuralgia, or the trigeminal nerve itself, originates from. Some of the theories related to this symptom that he'd been dealing with, talking about even a vascular note of this irritation coming through, where it is supported by the area of the mid part of the brain, around the pons area. If there is a swelling of that blood vessel, it could be causing direct pressure to that trigeminal nerve, which wraps around. Well, all of the things that we found for him were pointing in that direction of where the insult was coming from. So we found some apparent weakness that he had had, as well as some spasms and things into the area based upon the testing that we had done, which concluded that he did have what we in chiropractic call a subluxation. Now, the word luxation means dislocation, and sub means less than. So what that's really describing is that this hard bone that's designed to protect the nerves in his neck was actually moved out of its normal position and putting pressure on his nerves, causing this physiological reaction. Upon discovering that it was due to a misalignment factor, we were able to schedule him for a very specific X-ray series to be able to determine where these bones are resting and exactly what we needed to do in order to get them away from the nerve, creating this inflammation, and the opportunity to get his body the chance to begin to recover. The X-rays that we made were three-dimensional of the head and neck. One of them was from the side, we call the sagittal X-ray. Another view was from the top that we call the horizontal X-ray. There was a third X-ray that we call the frontal X-ray, which was a straight-on front, hence the name. And we also made a view to see the structures behind his teeth to make sure that nothing was being overlooked. From that meeting, we were able to conclude, and upon studying the X-rays, that he indeed had a misalignment of that upper neck relationship that was causing this nerve interference. So after that study was completed, we called him back to the office and we sat him down and reviewed those X-rays closely together. I have the X-ray chart here in front of me, and it showed that the very top bone in his neck had lost its proper position with the skull above. The name of the bone of the top is what we call the atlas. From our Greek mythology, you remember the atlas is the bone that carries the weight of the world on its head, if you will. And that's exactly what this atlas bone is doing, is carrying the weight of our heads on the neck. The bone itself had moved to the right. It had rotated out from underneath the skull in a right position, and the neck below had compensated to the opposite side. So the weight of the head was distributed to the right, and the neck was compensating to the left. The second bone in position was twisting to the right side, a substantial amount. We find that 3/4 of a degree of misalignment in that upper neck area is significant, and cumulatively, we found that there were over 8 degrees of misalignment in this upper neck region. We took that X-ray information into the adjusting room, and we lied him down on his side in order to mirror image or influence these joints and their structure back to their optimum position, and we delivered an adjustment to that upper neck structure. Now, the type of adjustment that we made utilized a table-mounted percussion adjusting instrument. There is a solenoid mechanism that will elicit a compressive wave off of the end of the instrument to deliver something similar to a sound wave in principle to gently move the bone to its normal position. Now, with the specific nature of where his injury was coming from, as well as how closely we had measured his X-ray, we weren't about to guess how well we made our adjustment either. So after resting for a few moments and seeing some of his other objective findings reduce or improve, We were able to take him into the X-ray chair again to measure his correction, and we're able to conclude that we did indeed achieve our goal of reducing the misalignment factor in his upper neck and allow his healing process to begin. One of the questions that patients will always ask me is, well, when are we going to start to notice a difference? I've been dealing with this for a long time, and doc, you're my last resort. I don't know what else to do. We always talk to them about, especially in this situation here, that this debilitating disease of trigeminal neuralgia that he was dealing with was a degenerative process, meaning that it wasn't something that happened right away. As we had stated earlier, this gentleman had been dealing with it for over 12 years now. Looking at starting this healing process, we were able to get the bones into their normal position to relieve the irritation, and that is what in turn began allowing the nerves to recover. We looked and saw that the nerves in their complete recovery would take somewhere between 90 to 120 days, but I was able to, based upon his findings, show that I was anticipating some degree of relief for him in about a 6-week period. Well, across the next couple of days and a couple of weeks that we were visiting, he was getting a little frustrated because he wasn't noting much change at all, not even any temporary relief factor yet, although his body was showing good signs of stability and that he was holding this correction appropriately. And his wife loves to tell this story as she wells up in tears about the improvement that he'd had. And it was on the day of that 6th week that this trigeminal neuralgia pain that he'd been dealing with for 12 years just turned off. It was absolutely amazing to see that degree of recovery. He's been also under active care now for for 2 years because not only has he received that relief factor, but there have been so many other things that he noted on his health questionnaire that have also been improving for him. Degrees of lower back discomfort, degrees of mid-back and indigestion stress that he was having as well. All of those things have been resolving with his correction that he'd had. By getting this nervous system back online and recovering. So it's just an amazing story that he'd had, and I'm so happy to be able to share with others that they have that same opportunity for a glimpse of hope. If they are suffering with that same type of stress, there may be an alternative to medication that causes side effects. There may be an alternative to expensive and unnecessary surgery that may, again, not be as fruitful as what the individual is looking for, being able to assist them with their recovery.
How did the problem begin with this guy again? What was the incident that caused the injury?
Well, we weren't able to uncover a specific injury that he had had, but a lot of the time stiff and stress factors are involved, whether it be a physical trauma like a car accident or a sports injury. Sometimes we find that it may be chemical type of stress, dealing with environment and exposures, allergies, those types of things. It may have even been into things like an emotional type of stress, and dealing with the emotionally and behaviorally disturbed children that he had been doing in his classroom setting, may have been enough to at least set the stage for vulnerability and for irritation for him.
Okay. Well, thank you very much, Dr. Fowler. Very good story. Take care.
You're welcome. You're welcome. Thank you, sir.